Ligaments in the larynx are categorized into two main groups, including the intrinsic and extrinsic. The intrinsic ligaments attach to the cartilages of the larynx by their two ends. However, the extrinsic ligaments attached to the cartilages by their just one end, and their other end is not attached to the cartilages of the larynx. The cricotracheal ligament is a good example for extrinsic ligaments because as you see, its upper part is attached to the larynx, to the cricoid, the cartilage of the larynx. However, its lower part is not attached to the larynx and attaches to the trachea, so it's an extrinsic ligament. Another example is the thyrohyoid membrane or thyrohyoid ligament extending between the thyroid and the hyoid. Another example for extrinsic group is hyoepiglottic. As you see, this ligament extends between the hyoid and epiglottis, so it is an extrinsic ligament. What about the intrinsic ligaments? The cricothyroid ligament is a good example for this group. As you see, this ligament extends between the cricoid and thyroid, and its both ends attached to the cartilages of the larynx. So it is an intrinsic ligament. Another example is quadrangular. Here is the left quadrangular membrane or ligament, and here is the right one. And here you see the larynx from its superior view, and here are the arytenoids, and here is the epiglottis. And as you see, the quadrangular membrane or ligament extends between the arytenoid and epiglottis, so it is an intrinsic ligament. The cricothyroid ligament is clinically important because in clinic and in larynx surgery is used for cricothyroidotomy. Here is the thyroid cartilage, here is the cricoid, and here is the cricothyroid ligament between them. In larynx surgery, this procedure is called cricothyroidotomy. Like ligaments, the muscles of the larynx are categorized into extrinsic and intrinsic. And here you can see its extrinsic muscles, for example the sternothyroid or thyrohyoid. They are extrinsic, because their both ends are not attached to the cartilages of the larynx. For example, the external thyroid originates from the sternum. There are several intrinsic muscles in the larynx, and here you can see one of them. This muscle between the cricoid and thyroid is a cricothyroid muscle. So remember that we've got the cricothyroid joint, we've got the cricothyroid ligament, and we've got the cricothyroid muscle containing two parts. Here is the straight part, and here is the oblique part of the cricothyroid muscle. By action of this muscle, the thyroid cartilage moves forward and downward, and its action lengthens the vocal cord to speak louder. This muscle is innervated by the superior laryngeal nerve, by the external branch of the superior laryngeal nerve, and it's important to remember that the only muscle in the larynx innervated by the superior laryngeal nerve is the cricothyroid muscle. The other muscles in the larynx are innervated by the recurrent laryngeal nerve. Okay. The next muscle is posterior cricoarytenoid muscle. Here is the right and left posterior cricoarytenoid muscles. Each posterior cricoarytenoid muscle originates from the posterior aspect of the cricoid and runs superiorly and laterally to reach the muscular process of the arytenoid. These muscles are abductor of the vocal cords, and remember that the only abductor of the vocal cords are posterior cricoarytenoids. Unlike the posterior cricoarytenoid, the lateral cricoarytenoid muscle, here is the lateral cricoarytenoid muscle, is adductor of the vocal cords. They are adductor. And here you can see the thyroarytenoid muscle. Here is the thyroid cartilage, and here we've got the arytenoid. So this muscle between them is the thyroarytenoid muscle. Here is the thyroepiglottic between the thyroid and epiglot, and this muscle is a thyroarytenoid. The thyroarytenoid, here are the thyroarytenoid muscles from superior view. These muscles act as a sphincter, during swallowing. And here above the posterior cricoarytenoid muscles, we've got some other muscles. This one is the transverse arytenoid muscle, and these muscles are oblique arytenoid muscles. There are two oblique arytenoid muscles, and these muscles, both transverse and oblique arytenoid muscles, are adductor for the vocal cords, and all these muscles, as I said, are innervated by the recurrent laryngeal. Here is the sagittal section from the larynx, and you can see interior of the larynx, and here we've got two folds. The superior fold is vestibular fold, and the inferior one is the vocal fold, because it contains the vocal cords. And this area between two folds are ventricle. Here is the ventricle of the larynx, and here this area above the vestibular fold is the vestibule of the larynx. Here we've got coronal section from the larynx, and you can see both right and left vocal folds, and also you can see both right and left vestibular folds. Here is the vestibular fold, here is the vocal fold, and here is the ventricle between them. it's important to remember that this area between two vocal folds, between the right and left vocal folds, is called glottis. Here is the glottis between two vocal folds, and because of that, this cartilage is called epiglottis, because it's situated above the glottis, and this area inferior to the glottis is called infraglottic area. The larynx is supplied by superior and inferior laryngeal arteries. Here is the superior laryngeal and here is the inferior laryngeal branches, originated from the thyroidal arteries. The superior laryngeal artery originates from the superior thyroidal artery, and the inferior laryngeal branch originates from the inferior thyroidal artery. Its venous blood drains into the thyroidal veins. And as I said, the larynx is innervated by branches from the superior laryngeal and recurrent laryngeal, which both of them originate from the vagus nerve. Here is interior of the larynx, and you can see the internal branch of the superior laryngeal, and here is the recurrent laryngeal, and here in the larynx they reach each other to form the ansa galeni. Ansa means arch of Galeni. Thanks for your attention. Hope this video was useful for you.